My name is Mary Reed. I'm a researcher at Kaiser Permanente's Division of Research. My colleagues and I are publishing a paper in the Annals of Internal Medicine looking at how electronic health records affect clinical care and outcomes for patients with diabetes. We found that using an electronic health record was associated with improved drug treatment, with improved monitoring for glycemic and lipid targets, and ultimately better control of diabetes for patients.
All right, let me just go over the medications.
This is the first observational trial of this magnitude. 170,000 people with diabetes across 17 medical centers in Northern California. That's an awful lot of patients. As clinicians, we're interested in the development of the electronic medical record. And I think there have been a lot of questions and concerns about just how it would impact patient care. Would it make patient care better? Would it make it worse? Would it make it harder for the doctors or harder for the patients to get the care they need? And I think this study gives us some answers to these important questions. Number one, it appears that it's helpful for the patients. And when I say that, I mean that in this large trial, people who had poor control of their diabetes got better control. And furthermore, the patients who needed the most care seemed to have the most intervention. In other words, those patients with the worst diabetes control had the greatest likelihood of having their doctors increase their medication, something we call treatment intensification.
Even after adjusting for patient factors, for time trends, for other factors, we found that patients' blood sugar control, cholesterol level were measurably better if their clinician was using an electronic health record. Our next step in this study, funded by the National Institutes of Diabetes, Digestive, and Kidney Disorders, is to understand how electronic health records affect downstream events for these patients with diabetes. So if their glycemic control and lipid levels are better, what about things like emergency room visits or hospitalizations? Those would be important things to understand when we're studying the impact of electronic health records on patient health.